Now, if you turn your handouts to what's called CD letter number 1, this is the way we worked with the kids to introduce the notion of cognitive distortions. And we did use the term cognitive distortions and tried to help them identify which, if any, of the typical cognitive distortions they might be using. So here's the letter. Dear problem solver, here I am going into my last year of high school and I've never accomplished anything. When my guidance counselor asked what I wanted to put on my college applications, I could not think of anything. She said I should talk about my 3.1 grade point average, but grades have always been easy for me to get. Then she said I should mention that I played on the school baseball team, but my father taught me to play baseball when I was little, so that's really his accomplishment. Next, she suggested that I write that I was the editor of the school newspaper, but my mother's an English teacher, so I'm sure that's how I got to be the editor. After we talked about this college application stuff, my counselor asked me how things were at home. I told her that my job was bringing in some much-needed money for the family. It's a pretty easy job. My 6 younger brothers and sisters are doing pretty well. I've been able to help out my mom with taking care of them since my dad has been disabled. They are really easy to take care of. Anyway, back to my point. What do you put on a college application when you haven't accomplished anything? Now, these are, we kind of had fun making up these letters. Obviously, they're kind of ridiculous, but the manual includes 6 letters, and each letter is characterized by one, ridiculously prominent cognitive distortion. So this author, Skip LaPlus, does not pay attention to anything good, okay? So this is an example of discounting the positive. And many kids who are depressed or who are prone to depression tend to do this. They don't pay attention to things they've done or good things that happen, and they're really focused much more on the negative. So in a treatment session where I introduce this, I'm not going to give the kids 6 letters to read. I'm going to pick a couple that I think might hit home. They might be able to say, oh yeah, I do that. Okay. And then on the next page is the handout that we used to just describe some common cognitive distortions. The David Burns book, Feeling Good, has a list of some more than this. These are included there, but there are some additional ones. We're trying to keep it a little short. And basically, I think they're all the same anyway.
This is going to be my question. You talked about confessions earlier. Do you ever switch around? Dean McKay has his old relaxation workbook, which has 21 distortions.
21, really? Wow.
And I sometimes will pull that one out because it's got the fallacy of fairness and the over control, under control have to, if that's that kid's.
Yeah, if that's that.
Switch.
Yeah, if that's the kid's thing, that's what I would try to tailor it to the kid. So if it's one that's not on this list, I try to pull another one up. I might even write another letter, I wrote all these letters, so I think they were a lot of fun, And then in subsequent projects, Betsy Kennard at Dallas wrote some that were really cool, and other people, you can write them, they're fun. So yes, I would switch around and use other cognitive distortions out of another book if I thought it was typical for the kid. So they're all pretty self-explanatory. Black and white thinking, or all or none thinking. You see things as perfect or terrible. People are all good or all bad. You have color blindness for gray. Can't see any grays. Catastrophizing we talked about earlier. You react to a failure or disappointment as though it means the end of the world. Jumping to conclusions. You assume the worst without checking the evidence. So if you have somebody who does this one a lot, then you might want to use what's the evidence as your method of cognitive restructuring. Missing the positive is this one. My fault, taking responsibility for things that are not your job or not in your power to control. Believe me, working in a major medical center, I have absolutely mastered the skill of not taking responsibility for things that are not my job or not in my power to control. And you probably need to do that. I don't know where you don't need to do that. You certainly need to do it in an academic department. You need to do it in a corporation. And you probably even need to do it in private practice in some ways. Shoulds. This is one that Albert Ellis talked about a lot. Shoulds and musts. You get all over yourself or criticize other people with ideas about what absolutely must be done by you or them. And it's the absoluteness of it that leads to the rigidity and the emotional intensity. Now, what other ones have you seen in... well, you mentioned two. What were they again?
Fallacy of fairness, that everything has to be fair.
Everything has to be fair. Okay.
Fallacy of control, that I either have to have total control or I have no control.
Oh, I have no control. Okay. So that's a version of black and white thinking. So the fallacy of fairness, you know, Jimmy Carter, right? Life is not fair.
Life is not fair.
Huh? Remember that? I mean, I'm really showing my age here. You remember Jimmy Carter? He's still alive, actually. Well, I remember he was president. He gave some talk when he said, you know, life just isn't fair. And boy, he got crucified for that, for saying that in a speech. It was a Malaise speech? A malaise has settled over the country. Okay, so any others that you recognize that are not on this list or used?
You say predicting the future, fortune teller?
Fortune teller, okay. So you know exactly how things are going to turn out.
Mind reader?
I know what you're thinking. Mind reader is one that, yeah, that's a really tough one. That can be tough to crack. They really think that they know what's going on inside somebody else's head, and they really don't.
What's the evidence that they do?
Right. What's the other thing to do? Right. 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 How about emotional reasoning? Remember emotional reasoning?
If I feel angry, I must have a right to be
I must have a right to be angry. If I feel that you are being disrespectful to me, you are in fact being disrespectful to me. That's reasoning from the emotion to reality. You know, it may or may not be accurate. Okay. Sometimes you run into this in patients who... This gets a little tricky with patients where you want to affirm their emotion. You want to, what they call, validate their emotion without validating their reasoning. Okay, so I understand that you feel disrespected. Okay, we don't say, no, you don't feel disrespected. But does that necessarily mean that somebody is actually disrespecting you?
On the side note of that, and I run into this with parents all the time.
Yeah.
Right? How many times they come in, the problem is the child doesn't respect me.
Right.
You know, because the teenager, you've asked them to take out the garbage and they're rolling their eyes and maybe even mouthing the B word or whatever, those
Right.
kinds of things. And too many parents get over involved in that, I believe.
Mm-hmm.
So I try to redefine respect. Because the
Mhm.
problem is if you get into it too much with them about, that you rolled your eyes, excuse me, what did you say? Those kind of things. Now we're no longer talking about the garbage, which never goes out, and we're all about disrespect.
Right.
The fact is, if the garbage goes out and they're
Mhm.
muttering things under their breath, they're just being a teenager,
Right.
and they're going to take it
Mhm.
out, and that's the
Right.
respect.
That's
When they've followed through,
Right.
you've earned their respect.
Right. Exactly. Good point. So you're separating the affect from the behaviors, distinguishing the affect from the behavior. Any others that you've seen with people or you like to use in your practice? The selection of these 6 was rather arbitrary. We could have added a couple more or taken away a couple of these. What I do is I'll use a letter like the one I showed you, and then I'll then hand the child this list, and we'll go through these, and I'll ask them, which ones of these do you think you sometimes use? And especially, which ones of these do you use in situations where you start to feel bad? Okay. So I've had a few cases where, this is the reason I continue to use this even though the Beck Institute doesn't use it anymore. I continue to use it because it's easy to learn and it's easy to remember. And kids can identify one or two of these, and then they got something to hang on to when they go home. And even they might hang on to it for years. You know, fortunately, I have a few former patients who check in every once in a while, and they still remember ribeye, and they still remember what their cognitive distortions were, and you know, it's just something you can hang on to. Oops. Oh, I see. This. Excuse me, that slide is in the wrong place, so I'm just going to skip it. So you identify the cognitive distortions, and then before that, you teach adolescents to identify their distortions using a letter, and then you can use the cognitive distortion on the weekly monitor. So remember the weekly monitor that we talked about before lunch was event, thought, emotion. 3 columns. You can add a 4th column, or you can type out on the form what their cognitive distortions typically are, so that then they can identify when they're using a cognitive distortion. So you can either make it a 4th column, cognitive distortion, or I think what we did in TADS is we listed these right on the form, just by name, all 6 of them, and they just checked which one they were using. So they start to monitor their cognitive distortions. Now, but the bottom line in all this is to be able to identify, I don't know, I can't think of a good name for this. A lot of people didn't like this term. I think it came out of the Coping with Depression course, but realistic counter thoughts. Realistic counter thoughts being thoughts that are more realistic than your distorted or depressive ones, and they kind of counter the negative thought. So for example, if your negative thought is, nobody will ever like me, what would be a counter thought? Realistic counter thought. Some people do like me, and you can even list the names of the people if you want to convince yourself, okay? So some people do like me, that's a counter thought to nobody likes me. It's ideal if you can get the adolescent to construct these counter thoughts on their own, if you can get them to come up with them. But if you can't do that, you can use a list. And there's a wonderful list of these in the Greg Clark Coping with Depression manual for adolescents. And we have a list in the TADS manual of common positive counter thoughts. Okay, so I don't, do any of you do group therapy with adolescents? So one of the things you can do in group that's really powerful, after the group's been going for a while, if it's a closed group, it's easier because they really get to know each other. But you can ask them to each do this. Each person has to say one positive thing about everybody else in the group, and it can't be they're nice. Can't be that. That's too bland. They have to say something specific. And so if you got 5 or 6 kids in the group, then each kid is going to get 4 or 5 positive comments from other people in the group, which are really pretty much true. I mean, they're pretty accurate about each other after several sessions of group therapy. And that's another way to generate positive counter thoughts, and it's very powerful. It's a very powerful experience. So you can do that if you're doing group CBT or other models of treatment. So those are usually the three ways that you do this. You ask the teenager to come up with a counter thought themselves, or you give them a short list and ask them to pick one that's accurate, or you have peers. I suppose you could do this with parents too in a family session. Once these positive thoughts, either constructive beliefs or realistic counter thoughts, are identified, you can write them on index cards and give them to the kids to take home. And you might even ask them to practice reviewing these thoughts during the week. You know, a couple times a week, not when they're upset, but just when they're feeling their regular self. Get used to thinking about these things, okay? Now, I'm going to mention something that's not in the TADS manual, but it's another method that I learned from Kevin Stark. Kevin is at the University of Texas in Austin and does a lot of work with depressed kids in schools and also in clinics. And he has a method of building up the self-schema, where you get kids to write down things that are positive about themselves in one area or another. So you may remember that yesterday I mentioned people whose self-schema is very narrow are vulnerable to depression if they suffer a blow in that area. So if my only sense of self-worth is as a student, okay, and I have a bad time as a student, then there isn't anything else to kind of buffer me from that, okay? Or if my only sense of self-worth is from my work and I have a problem at work, then I'm more vulnerable to depression. So this method that Kevin uses has kids write down different areas of their life, like friends, family, school, hobbies, sports, interests, and so forth, and then to write something about themselves in each domain. And he keeps coming back to this over time to build it up and make it stronger. And that does give you both a more differentiated self-image and more protection against vulnerability to depression. So that's more elaborate than this, but I like the method. I've been talking this whole time about the Beck model. Automatic thoughts, dysfunctional attitudes, and core beliefs. There's another cognitive model about attributions. And this was written about by Seligman, Marty Seligman, and Lynn Abramson, and Abramson, Seligman, and Teasdale, I think, was the first article about it. So here's what these guys say. And they're talking about how you explain things to yourself after they happen. So if let's go back to the auto accident experience. I'm in an automobile accident and my car gets banged up. What caused that accident? What are some possible explanations? Neglect on someone's part. On whose part? Okay, so it could be the driver of the other car. Okay, that's one possible explanation. It happened because the driver of the other car was neglectful. Okay, hold that in mind. Now think of another explanation. What's a depressive explanation? My fault. Elaborate on that a little bit. It always happens to me, right?
I should have done something.
I should have done something. Okay, so you can really beat yourself up on this. It was my fault. I always screw up. I never drive right. Okay, that's an internal stable attribution. It's my fault and it's always my fault. If I add to it, it's my fault and it's always my fault, and not only am I a lousy driver, but I'm also no goodnik in work, family, and all my relationships. Then you got a global, right? That's an internal negative global.
Anything.
Can't do anything right, okay? Now, you'll notice the difference between the first explanation. It was due to neglect on the part of the other driver. What kind of an attribution is that? External, specific, and probably unstable. You're not saying that, not that it makes any difference, but you're not saying that this guy's always neglectful. Maybe he was, maybe he wasn't, right? So what Seligman argued was people who are prone to depression are more likely to make internal, stable, and global attributions for negative events. And in a secondary way, I'm not sure how much he said this, but other people have said it. They also make external, unstable, specific attributions for positive events. So, you know, when something good happens, they don't take personal credit. It's just kind of a fluke. It's not going to happen again, right? So that's what underlies this last cognitive method that I wanted to cover with you. Now, the way we did this in TADS, you can do this different ways. You could set up a module to deal with attributions. We just didn't do that. We already had too many modules. So I didn't want to make another module. But we asked clinicians to do this in every session. So at the beginning of the session, what's the first part of the session? Remember? Agenda setting and homework review, right? So you're doing the agenda setting and homework review. And suppose the kid comes in and says, well, you know, I had a pretty good week. I got to meet a new friend. I think we're going to get along pretty well. Positive event, right? Now, if you want to do attribution work on that event, what would you say?
What did you do right?
What did you do to make that? What did you do to contribute to that? Right? And you know, some kids act like, when you say that to them, they think like, well, there's a wild idea. I did something to make that happen? I mean, they just don't think that way. They don't think that when good things happen, it's because they have anything to do with it. So we really encourage therapists to jump on positive events and ask kids what they might have done to contribute to them, so that they start to take internal credit for good things that happen. And I guess we actually emphasize the internal dimension more than the others. But, you know, you could add to it, well, you know, maybe you have some personal features that this other person likes, a kind of a stable dimension, you know. And then you can do the same thing with negative events. But instead of trying to get them to focus on the internal cause, you may acknowledge that there's an internal cause, but you'd also look to see if there were some external causes or some unstable causes. So I think this came up yesterday in one of the role plays where if a kid comes in and says, I had a really bad week, I flunked a test, and you ask them, oh, what do you think led up to that? And they happen to say, well, I didn't study very hard for the test. Okay, that is an internal attribution, but it's not stable or global, because you could do it differently. You could act differently the next time, and you could study, and you'd probably have a better payoff. So even with negative events, it's good to try to help them think about them in a way that's more specific and more narrow. Okay? And more unstable. And stable has to do with time, and global has to do with kind of space, you know, or extent. So I find this very helpful. And most of the time what I'm really trying to focus on is getting kids to take credit for good things they've done. And if I feel like if they can do that, they're really going to kind of crack through the depressive depressive thinking, okay? So these come up in many sessions, especially at the beginning of sessions when you're working on the agenda items or on the homework. If they do some of the homework, then that's a positive event, and you can help them look at what did they do to make it possible for themselves to do the homework. Okay? They did some good things. Okay. Here's all kinds of other, here's a negative event. So somebody gets dumped by their significant other. Why did I get dumped? I am unattractive, I am a loser. Oh, this is for a girl. I am unattractive, I am a loser. He is an idiot. He found someone else. What a break. Good luck. Okay. These are all different ways you could think about it, breakup, right? Now, not too many people are going to come in with the last one, but they might, they might in a couple more weeks, But I am unattractive or I am a loser, those are both internal, stable, global attributions for negative events. So you want to help them look at other things that are going on. Maybe there's something wrong with the guy, or maybe he did find somebody else. Now that's very painful, but it's not internal. And here's a good event. Why did our team win? Oh, we won because the other team was weak. Well, that's an external, not very helpful to build up your self-esteem. My teammates are talented. That's external to the person. We are a good team. Okay, we are a good team. That's a little more internal. We got lucky. Well, that's external chance. All right, so I'm going to go to the next section. Do you have any other questions or comments about the cognitive stuff? This is all I had prepared on. Yes.
I don't know if it was something that I missed yesterday in the beginning, but when you get to this stage, and let's say the patient starts to just kind of focus, and the thoughts are recurring, and just rumination,
Rumination.
repetition, and just obsessive thinking. I don't know how this can help, or can it? Can you show me how it can help using this approach?
Well, that's a good question. I'll repeat the question. The question is, can this approach help when people are ruminating, right? Basically when they're going over and over and over and over. So I had a chance to talk with Susan Nolan Huxama, who works on rumination. That's her thing. And her theory is that this is why women get depressed more than men, because women do more rumination. Rumination is unproductive, repetitive, focusing on negative thoughts or feelings. Okay? So, or behavior. So if I do something bad and then I feel guilty about it, but I just keep stewing on it, that's rumination. Okay, and she thinks women do more of this than men. Well, she's got evidence that women do more of this than men, and she thinks that's why more women are prone to depression. So she gave a talk at Duke last year, and I had a chance to meet with her, and I said, how did you get into this stuff? This stuff really seems interesting. How did you get into it? Because I always want to know how people got into things. So she said she was working with Beck in the clinic at Penn, and she was trying to do this cognitive therapy with people, and it just wasn't working because they just kept ruminating. So she was forced to look for other methods to break rumination. So one of the methods you can use to break rumination is to go back to problem solving and stop the cognitive work and say, all right, let's put this aside for a minute. You have a problem here. What are some things you can do about it? And get them to be more active. That's one method for breaking rumination. A second one is, and I really don't remember what she said to do. I mean, she talked more about her research project on rumination, but one other thing that people do for rumination is literally get the thought out of your head by writing it on a piece of paper.
Thought stopping, isn't it like?
Well, yeah, thought stopping is a third. I don't know how well that works, but you put a rubber band on your wrist and snap it if you have the thought. Yeah, that's classic thought.
Stop sign.
Yeah, that's okay if that works. I mean, if it works, do it.
Well, Or like they have a cartoon of a single session therapy snack.
Yeah, that's extreme, right. But I find a lot of people benefit from getting the thought out of their head. They put it on a piece of paper, and then they come back to it later, and then they come back to it with the intention of trying to do problem solving.
I usually have the kids that have this slide, I have them crumple up the paper
Mm-hmm.
and throw it
And throw it away. Okay. Well, if that works, that's good. You know. I find rumination difficult. I mean, I've been known to do it, and I have a hard time getting out of it. That's what I'm trying to say. But yeah, that's what I use. Okay, and with people who can't sleep at night because they're ruminating, definitely use that. Write it down on a piece of paper and tell yourself when you're going to come back to it. But always come back to it with the idea that you're going to do problem solving, not more thinking about it. It doesn't do any good to think more about it. A third thing you can do is seek seek consultation or social support. So sometimes you run into a problem at work where you just don't know what to do about it. I mean, a serious problem. And, in the past, I would sometimes ruminate about stuff like that. It was utterly unproductive and useless. Whereas if I just went to talk to a colleague about it, I get a fresh set of eyes and some ideas. So the key is to get into action and get out of your head. When you're ruminating, you're in your head too much. So you have to get active. You have to do problem solving. And anything that helps you to do that, I think, is good.